Welcome to Clyde Ellis Medically Speaking. Each month, we'll explore a variety of topics to help you better understand certain medical conditions, treatment options. My guest today is Cassandra Church, the Senior Director of Nursing Services at OCH Children's Hospital. In this episode, we'll be discussing the importance of breastfeeding and some of the initiatives Children's Hospital is working on to educate and assist new moms. I'm Mike Hughes, and this is Medically Speaking. Welcome, Cassie. Thanks for joining us today.
Thanks for having me.
I know Children's Hospital has done an awful lot with breastfeeding awareness and education. If you can tell us a little bit about the importance of that and why the hospital is going down that road.
Sure. Children's Hospital is working a lot. We're on the path to what they call baby friendly, which is a designation signifying that we have some of the highest trained nurses and lactation staff around the country to help moms with breastfeeding and just baby care in general.
Sure.
So it's really important to us because we know that there's a lot of evidence related to breastfeeding and just good feeding practices in general that help protect infants from things like GI issues, tummy aches and stomach upset, ear infections, and frequency of viral illnesses. So you think of that through their entire childhood. And from a mother's perspective, breastfeeding actually helps her a great deal in terms of lowering her risk for diabetes and ovarian and breast cancers.
Gotcha. So the designation really is the programmatic response to what you guys are doing?
Correct. The designation just recognizes our staff for the amazing work that they're doing.
Sure.
And it's primarily about feeding, but not just breastfeeding. A lot of it's about bonding with the mother the first 2 hours of life, making sure baby goes on mom's chest to improve that bonding. It also helps with the baby's transition to extrauterine life. And if a mom opts to formula feed, it also designates that we have given them the appropriate education on how to do that safely from a mixing and storage perspective.
So in terms of the work that you guys are doing programmatically, have you seen the breastfeeding rates increase in terms of adherence to that?
We have actually, since we started the process. So over the last few years, we've done a lot of education and just working with the community. But locally, what we track are our birth certificate records. So we look at how many moms indicate they're going to plan on breastfeeding after discharge and how many have at least tried it while they're in the hospital.
Sure.
And those rates have nearly doubled in terms of attempts at their time during the hospital stay. And we're up to 43% primary breastfeeding upon discharge.
So on the breastfeeding education piece of it, is it important for both your staff or the nurses as it is for the mom and say the father of the baby?
It is. A lot of the education has to do with general baby care. So how do you know when a baby is giving you a cue for hunger versus discomfort? That's a big piece of the education. How do you soothe them if it's not because they're hungry? Is it changing a diaper or is it simply holding them close because mom and dad are the voices and heartbeats that they know best?
Right.
The education is not just for the inpatient stay. A lot of the education actually takes place at our 2 women's health centers around the city, as well as our maternal fetal medicine clinic.
Right. When you talk about breastfeeding and all the work that has been done and special designations like you guys are seeking, is there more of an acceptance in the community for this? Is the stigma being erased because of programs like this?
I think so. I think that programs like this allow us to support the community and the mothers in the community however way they decide to feed. Be it formula feeding, we're giving the education for how to do that safely. Be it breastfeeding, we're giving the education on how to do that well and the benefits to it. So I think nationally, there's a lot of awareness around breastfeeding and the concept of breast is best or being fed is best.
Sure.
But how to do that safely is really what's important to us.
Sure.
And here in Buffalo, it's amazing. We've done a lot throughout the community. Educationally speaking, we see the evidence in our numbers, but also just the conversation and the buzz that you hear around the community related to our support.
Sure. So the new hospital is less than 2 years old. There's been an awful lot of achievements and accomplishments thus far. Talk a little bit about another service that you're offering, the Baby Cafe. What that is.
Yeah, Baby Cafe is one of the neatest things I've seen rolled out at a facility. I've worked at a lot of children's hospitals, and this is the first one where I have seen essentially a a mom support group rolled out with lactation consultants running it, as well as nurses being present to help moms every single Wednesday here on site at the hospital. Every Wednesday, we have people on site to help them not only with breastfeeding, but just baby questions.
Sure.
And we actually had one of our first enrollees took her first steps about 2 weeks ago. So the nurses got to witness that. And there's a great kind of relationship building that's happening. And we actually have a couple of fathers that participate as well.
That's great. So that's at the hospital. Before you talked a little bit about what you guys are doing out in the community, if you can, tell us about the initiative with the Mamava and what you're doing with the Buffalo Bisons.
Great. So the Mamava pod is essentially an enclosed breastfeeding room that we have put at Bison Stadium with the goal of allowing moms to safely feed and support their infant while they're out at a public venue. Our partnership is fantastic. We were able to do some education on site at the stadium. Sure. We had some of our educators with us the day we had the grand opening of the Mamava pod, and we look forward to having more of them around the city.
Yeah, so talk a little bit more about that. Where else would you see these popping up, or where would children's like to see some of these pop up?
We like to think everywhere, but the beauty of the relationship with Children's and the city of Buffalo is that anywhere there could be a large venue or an entertainment space, things like the waterfront or other locations for events, I think are probably our next best locations.
Gotcha. So in wrapping up, I'm a family member. My wife's pregnant, my niece is pregnant, my daughter's pregnant. They want to learn more about breastfeeding, or they're planning on having a baby. So what can families do? What can expectant moms do to learn more?
There are a number of ways they can learn more from the OCH website, where we actually have a baby-friendly button that they can click on and receive some of this education themselves. They can join us if they're a new mom at Baby Cafe. You do not have to have had your care or your baby delivered here. Okay. Everyone in the community is invited. Our 2 women's health centers, as well as the maternal fetal medicine clinic, have educators on site, and we do have baby care and birthing classes hosted here on site.
Great. Well, thanks for joining us today. Congratulations on all the accomplishments, especially with your breastfeeding rates and the work that you guys do in the community.
Thank you for having me.
I'm Mike Hughes. We'll see you next time on Medically Speaking.